In this video, we'll be explaining in detail about the Whirlpool bath. So, by the end of this video, you will be able to understand what are the introduction, what are the different Whirlpool temperatures, what are the equipments required, what are the procedure, advantages, disadvantages, indications, contraindications, and precautions of Whirlpool bath. So coming to the introduction, a whirlpool is composed of a tank that can hold water and a turbine that provides agitation and aeration to move the water in the tank. The tank is usually made up of stainless steel, although fiberglass and plastic tanks are also available. Whirlpools are available in a number of different shapes and sizes to allow for treatment of different body parts. So this is the part of a or components of a Whirlpool turbine. So you can able to see the switch, the throttle, the suspension bracket, the horn, the water intake, and the turbine ejector, and the butterfly valve. Extremity tanks are suitable for immersion of a distal extremity, such as the hand or foot, whereas low boy and high boy tanks are intended for immersion of larger parts of extremities and may be used for immersion up to the waist. So you can either use extremity tanks for your upper extremity as well as your lower extremities, or you can use low boy or high boy tanks, so which are mainly used for immersion of the large body parts until your waist region. And Whirlpool turbine is composed of a motor bracketed securely to the side of the whirlpool, along with the pipes for air and water circulations suspended in the water. The height and direction of the turbine can be adjusted to project the water pressure towards or away from the involved area. The turbine may be directed towards the involved area to apply maximum forces, as may be desired to control the pain or to remove tightly adhered wound debris. So our focus or goal is to reduce the pain or to remove the wound debris, means the turbine should be directed towards the wound area or the involved area. The turbine should be directed away from the involved area if the area is hypersensitive or if the granulation tissue is present, because high direct pressure of the water from the turbine can cause adversely affects such conditions. Most turbines allow the clinicians to open or close the aeration valve to further modify the pressure of water flow. So whirlpools generally are used for exercise or pain control in limited areas of body, such as the leg and foot or the arm and hand. They are occasionally used for treatment of open wounds, particularly in patients with extensive wounds such as burns or with wounds which mud debris, as may occur during a motor vehicles or bicycle crash. So this is one of the extremity tanks of your whirlpool. So coming to the indications. So what are the indications include? What are the indications that can be used for whirlpool bath is your poor circulation, chronic edema, separate dead tissue, pain relief in amputation, after removal of plaster cast, stiff joints, infected wounds, arthritis with stiff and swollen joints, poliomyelitis and paraplegia to improve circulation, traumatic and chronic inflammatory conditions such as your rheumatoid arthritis and osteoarthritis, weak and painful feet as preparation to massage, passive stretching, and exercises. Now, the contraindications include a feverish patient, a recent skin grafts, circulatory impairment, active bleeding, open wounds, hemorrhage, skin allergy, and macerations around a wound and bleeding. So these are the contraindications for your whirlpool bath. For the precautions include your impaired thermal sensation in the area to be immersed, infection in the area to be immersed, confused or impaired cognition, recent skin grafts. So all these patients should have some precautions during these treatments. So coming to the clinical applications and sensations of Whirlpool treatment in different temperatures. So these are the different temperatures and these are the different sensations to be felt, and in this different temperatures we will be treating at different conditions. So that will be explaining in detail in the upcoming slides. So first is your cold sensation of cold whirlpool that will be happening at 0 degree to 26 degrees Celsius, that is 32 degree to 79 degree Fahrenheit. It can be used in place of an ice pack or cold pack to treat the acute inflammatory conditions of the distal extremities. Cold water provides better contact with the contoured distal extremity than is provided by an ice pack. Low temperatures can be achieved by adding ice to the whirlpool water. However, very low temperatures should not be used on large areas because of increased risk of tissue damage. So low temperature mainly used for treating the acute inflammatory conditions of the distal extremities. If we want additional temperatures, we can add ice. So low temperatures can also be achieved by adding ice to the whirlpool water. So next called sensation is your tepid. So tepid water that is having temperature in between 26 degree to 33 degree Celsius, that is 79 degree Fahrenheit to 92 degree Fahrenheit, should be used in whirlpool if the water is being used solely as a medium for exercise. So warmer temperatures are likely to produce fatigue and colder temperatures can inhibit muscle contraction. A tepid whirlpool may be used when an inflammatory condition is present if lower temperatures are not tolerated. So the main functions of using, or the main indication for using this tepid water is, so we can use it as like a medium for exercise, as well as those who are not tolerable to colder or cooler temperatures can also use this tepid whirlpool bath. So next is your neutral warm whirlpool that is happening in between 33 degrees Celsius to 35.5 degrees Celsius, that is 92 degree Fahrenheit to 96 degree Fahrenheit. This should be used for treatment for open wounds and in patients with circulatory, sensory or cardiac disorders. Neutral warmth may also be used to control muscle tone in patients with neurologically based hypertonicity. So it can be used in spastic patient also in order to control the tone, as well as it can be used in treating the open wounds and some circulatory, sensory or cardiac disorders. So next temperature is the mild warmth. So that is 35.5 degrees Celsius to 37 degrees Celsius. In Fahrenheit, it will be 96 degree Fahrenheit to 98 degree Fahrenheit. So this temperature may be used for the treatment of burns once epithelialization has begun. Such treatment promotes mobility and relaxation and minimizes energy loss by cooling or shivering. So the energy loss will be higher in the cooler temperatures, and such cooling energy loss can be prevented or can be reduced by using this mild warmth temperatures. So this mild warmth also promotes or provides mobility as well as relaxation to the body. So next temperature is your hot whirlpool that will be happening at 37 degrees Celsius to 40 degrees Celsius. So that is 99 degree Fahrenheit to 104 degree Fahrenheit, for a very hot whirlpool at 40 degrees Celsius to 43 degrees Celsius, that is 104 degree Fahrenheit to 110 degree Fahrenheit, is recommended for control of pain and or to increase the soft tissue extensibility, because this temperature range of whirlpool water has been shown to increase the temperature of subcutaneous tissue to within the range required to produce these effects. So mainly the hot whirlpool or very hot whirlpool can be used in for the control of pain as well as to increase the stretchability or extensibility of the soft tissues. So if a particular region is tight or taut, means this particular temperature of 37 degrees Celsius to 40 degrees Celsius or 40 degrees Celsius to 43 degrees Celsius, that is a hot whirlpool or a very hot whirlpool can be used in order to reduce the tightness or in order to improve the flexibility of the particular structure. The higher end of this temperature range is recommended for the treatment of chronic conditions such as osteoarthritis or rheumatoid arthritis. So not only for controlling of pain as well as to increase the soft tissue extensibility. So it can also be used in chronic conditions, chronic cases such as your rheumatoid arthritis or osteoarthritis. So in non-acute phases, when small areas are being treated, the lower end of this range is recommended when larger areas of the body are to be immersed. The whirlpool, this is one of the important points. The whirlpool temperature should not exceed 43 degrees Celsius, that is 110 degrees Fahrenheit at any cost, because higher temperatures may cause burns. So you need to restrict the temperature below the 43 degrees Celsius, that is below the 110 degrees Fahrenheit, because higher temperature may lead to burns of the particular region that is being treated. The tank should be filled with water immediately before it is used to prevent the water temperature from changing excessively between filling and the patient immersion. If an antimicrobial is being used, it should be added to the water as the whirlpool is being filled. So during filling of the water in the whirlpool, antimicrobial can also be used and it should be added to the water. So this is the summary of the clinical applications and sensations of the whirlpool treatment. So in 0 to 26 degrees Celsius, that is 32 to 79 degrees Fahrenheit, that is the sensation is called, that can be used for treating the acute inflammation. Next temperature is between 26 degree to 33 degree Celsius, that is 79 to 92 degree Fahrenheit. The sensation is tepid and that can be used for medium for exercises and for the patients who is having acute inflammation and those patients that in which the colder temperature are not tolerated. Next degree is 33 to 35 degrees Celsius, that is 35.5 degrees Celsius, that is 92 to 96 degree Fahrenheit. The sensation is known as neutral warmth that can be used in treating open wounds and those who are having circulatory, sensory or cardiac disorders, or those who are having spastic conditions or increased hypertonicity. So in order to decrease the tone, we can be able to give this neutral warmth sensation. So next temperature range is in between 35.5 to 37 degrees Celsius or 96 to 98 degrees Fahrenheit. So that is known as your mild warmth. This can be used for increasing the mobility in the burn patients. So next temperature range is in between 37 to 40 degrees Celsius, that is 99 to 104 degrees Fahrenheit. So that sensation is known as hot and can be used for controlling the pain. Next is 40 to 43 degrees Celsius, that is 104 to 110 degrees Fahrenheit. That is known as your very hot sensation that can be used for increasing the soft tissue extensibility, as well as it can be used for chronic conditions such as your rheumatoid arthritis and osteoarthritis, and it can be used in limited body areas only. And the temperature range beyond or above 43 degrees Celsius or above 110 degrees Fahrenheit should not be used. That will be very, very hot, and that should not be used because it may lead to burn of the particular region that is being treated. So what are the equipments required? Includes your hot and cold water mixing valves, thermometer for checking the temperature of the water in the tank, a turbine to agitate and aerate the water, seat or stretcher for the patient to sit either in or out of the water depending on the area being treated and the configuration of the whirlpool, a gravity drain, heated well ventilated space is needed, and towels and blankets needed. So what are the procedure? So the first step is the whirlpool tank is filled with water. The water temperature is checked by the hand and the thermometer. Adjust the patient position in accordance to the treated body part and considering both comfort and security. Explain the procedure and reassure the patient. Place the body part in the water. Encourage the patient to move while keeping the body part under water during the treatment in case of joint involvement. After completion of the treatment, dry the body part and wrap it, keeping it warm. So what are the advantages of this whirlpool bath includes? It can be used for heat transfer, for cleansing and debriding the open wounds and for exercises. Patient can be positioned securely and comfortably in the whirlpool bath. Weaker muscles can move freely than on the dry land. It allows the movement while heat is being applied, unlike other conductive thermal agents such as hot packs. So what are the disadvantages for this whirlpool bath includes the size of tank limits the amount of exercises and the size of the area that can be treated. Large quantity of water is used for treating in whirlpool bath, and the risk of infection is higher, and the cost and time associated with cleaning the whirlpool is higher, and cost associated with heating the water is also higher. The time expended assisting the patients to dress and undress is also more. So by this, we are concluding about the whirlpool bath. Thank you for watching this video. Please do share and subscribe this channel. Thank you.